So how's it going today?
Hey, Nikki.
Hey.
Nice to see you again.
I know. We keep meeting like this, don't we?
For a few weeks.
Yeah.
We probably have a few things to talk about, but I think maybe we ought to take our mask off first.
I would agree.
Yeah, should we do that? And I'll let you use the hand sanitizer first.
Thank you.
And I'll use it second.
So we're glad that you all have joined us here this week again as well. This is, we're in almost middle of June now with these updates. There's been a lot happening in our community regarding COVID and other things as well around health equity and a lot of stuff going on. So let's share.
Yes, I don't know about your family, but my family is asking me this question every day, and I would love to have the expert tell me exactly how this works. There's a lot of kind of misinformation, miscommunication, ambiguity about what we should do. We see folks masking up in some stores and they're doing really, really well. You go other places and half the folks aren't being careful. We see parts of the country that are opening up. We see parts of the country still locked down. We get experts kind of giving us various viewpoints.
And really, we see that we're not allowed to have youth baseball games, but we can all pack on the beach.
Sure.
And that feels really confusing.
How do you see pictures of the hundreds on the beach, and they're pretty close. So how do we think about those things together?
Yeah, so this is where risk reduction strategy really comes in, because we know we're not going to ever eliminate the risk of COVID-19, where transmission is going to be with us at some level for a period of time. So it's really just thinking about how does transmission happen, and we know it's primarily person to person, so that close proximity does make a difference.
And it's probably mostly fingers to face. Probably less floating through the air, although we're trying to protect against that. Fingers to face is still a really important part of it.
Absolutely, because when somebody's talking and has droplets, relatively speaking, the droplets are heavy. They don't just aerosolize and float away out into the ether. They really kind of fall down, and we can touch them if they're on surfaces and then touch our face, which we're not doing.
That's still a problem.
That still is a problem, but it is that proximity. You don't want to be really in someone's spray zone of when they're talking or laughing and all of that. So
no,
you're safe.
I think we're safe.
We've got about one tiger length between us, so we should be pretty good.
Yeah.
Other things to think of with risk reduction is just the number of people, because I know that everybody you've been in contact with over the last 2 weeks, that increases my risk if I have contact with you.
Absolutely.
And so if you've got a pretty full social calendar, and then you and I are hanging out and we don't have the 6 feet
and I don't have a risk number on my forehead, so you don't know that, really.
I really don't know, but we have to assume that whatever risks you've taken on, you might be then exposing me to indirectly. And those are things that are important for us to think through as we re-engage in our social life and have the family barbecues and get together with family members and friends we haven't seen in a while. Again, continuing to think through how big you want your circle to be and how expanded you want your network to be at this point in time. And then how to reduce risk while you are together. Because even if we've both been around lots of others and potentially exposed, if we are being safe with one another, that dramatically reduces the risk of this interaction.
And I think our governor's done a pretty good job of executive orders around this topic. And as those get liberalized, it doesn't mean everybody has to go do that immediately. You still might, if you have elderly folks and you're protecting vulnerable and within your family, your community, you may still want to be more careful. I mean, to your point of reducing risk.
Right.
And I believe we want to see great results in our community across Berrien County for several weeks to know that we really have flattened that curve. And of course, we're going to be very careful that we don't see those ramp back up. But we're not seeing folks in the hospital much anymore. That's great.
That is terrific.
It's terrific, and it's just thanks to everybody that's been so very careful.
Right, and we've been really watching and really looking for and expecting to see increases since late May and Memorial Weekend, when we know we had a lot more people out. We had a lot of folks at the beach and other outdoor areas and starting to gather. We haven't seen that show up in the data yet, and I don't know if that's because many of the people who enjoy our wonderful county are from out of state, and we might not know about their infections that happen when they return home, but it's not showing up in our data. We're not seeing these. We're still seeing new confirmed cases each day.
Every day.
But it's fewer than it was a few weeks ago. And this week is even lower than last week was, which was lower than the week before that. And those are the exact sorts of decreases we've been waiting for and watching for.
Absolutely. We talked last time, Nikki, about a tough topic that some within our community, the vulnerable, and particularly the residents of color, they've suffered more from COVID-19. They've had more than their share of the disease,
Yep.
and more than their share of the complication, and more than their share of the deaths.
Yes.
And that's not only just in our county, that's across the country,
Right.
and certainly across the state. And we committed to do something about that. If it's okay,
tell us about
I'd
it.
love to
Yeah.
share what Spectrum Health Lakeland is hoping to do to be helpful. And that hurts us when we see those kinds of inequities within our neighborhoods. So we had a special board meeting of the Spectrum Health Lakeland board this week, and we laid out a 3-point strategy to kind of lean in and do more for social justice and to do more to help prevent systemic racism, and of course, do more to improve health equity. And that 3-part plan includes money, resources, leadership, and transparency. The resources the board set aside for this was $50 million, and to use the interest on that money to help fund health equity work. So for example, if we're using interest in that money, that would represent a $20 to $25 million spend over the next decade to help do that important work. Now that's not all we're going to do, but we're going to do that more than what we're currently doing. The leadership, I am delighted that Dr. Lynn Todman, who's been our Director of Population Health and has had such an influence in this area in our region, has taken a role as Vice President of Health Equity and joins our system leadership table here at Lakeland. She also has a role in Grand Rapids and is having a positive influence there. And transparency, I think, just so critical. We have to demonstrate to everybody, here's what we're doing, and here's how well it's working, and listen to others if they have good ideas, and to make that transparent to everybody, from our community, to our patients, to our employees, to our physicians, to our leaders, to our board.
Yeah.
And we plan to have that transparency rolled out here over the next few weeks or month. It takes a little time to build all of that in the data and the trend lines, but we are committed to the resources and to the leadership and to the transparency to help solve this problem.
Yeah.
And I should say that Spectrum Health in general has also made an announcement to increase their spending in this area. They're already spending money, clearly, but that is going to increase around 40%, which will net about $100 million spend over the next decade, specifically on this topic. And so I'm delighted that we're doing that as an entire health system. I'm delighted as the Lakeland Division that we can lean in and do that with some of our legacy capital. And we are just committed to do what we can to make that go away.
Yeah.
Breaks your heart, and we want it to stop.
And I think that that's incredible because we're hearing from a lot of individuals and we're hearing from a lot of organizations that are saying, we want to do something and we want to stand up for injustices, and we do want to show and demonstrate that Black lives do matter.
Mm-hmm.
And what I really appreciate in our local health system is that you're saying, not only are you saying, yes, we believe these things, but here's exactly how we're going to live into those values. And I think that's really important. And so I'm as a resident of Berrien County and a constituent of the Spectrum Health Lakeland recipient of services, I really, really appreciate that. It's been really great for the Berrien County Health Department to also be a partner with Spectrum
Absolutely.
Health Lakeland.
We appreciate that.
And we've been working together in the trenches on this issue for a while. With Lynn Todman has been leading that effort with us, and that's been a close partnership. And I think that this commitment of resources and leadership and transparency from the health system, I believe, is going to have a big ripple effect throughout the community, throughout other organizations that have an ability to impact the structures that lead to change.
Same. Hope live in a world that absolutely and reduces the community. It's stop, and so we're just to be helpful. And
I think throughout the pandemic, I thought that here at the health department, on these videos, we're really working with the community to promote health, to save lives, to understand how we're all up together. This is collective in our community, and this is just another outpouring of that is showing that collective really does speak to how we value life. We want to preserve health. So I think this is exciting. things have been stripped during home, maybe not do what we usually do, and really want to shape this. It can be a period of reshaping how we in this community, and I think really, really hopeful message collectively.
Well, I've enjoyed what we're doing around to try to take care of every week. What's happening?
Every week, because it's repetitive for those of you who joined us, as enjoyable as it is to share this time. We might be moving to an every other week cadence, or maybe a little bit less often, so please stay tuned to our Facebook page so that you can figure out how to get that. That doesn't mean there's a lot of information. Maybe take different videos, the only ways are communicating, so continue to just stay tuned to those things. I do want to ask you about as well, going back to just that compassion and reducing some of the suffering, and how can we put things back together. One thing that's been really difficult has been visitor restrictions in healthcare settings. Yeah. How is that changing or evolving right now?
Well, we're allowing visitors back. We're doing it carefully. The hours are not every hour. Having some limitation on visiting hours, and I hope that won't last long. We're just doing that to make sure we keep everybody safe, that they feel safe, and that the staff feels safe, and that we can manage it well. But we're allowing visitors back, one for every patient. Two, if you're a pediatric, we want to be as we can, any kind of end of experience. We're doing video visits with those folks available to a broad family member, if we can. So that's here. We're going to go with that this Monday, and we look forward to having the family members back, because they're an important part of the care team.
Absolutely. So one last thing, I mean, we've talked a lot about how the news has been really good. The data's been trending. We're starting to shift into many other phases of response. Does this mean we just stop? I mean, are we good? Do I really need to keep wearing this mask at work every day?
So we're doing that still, and are not ready to abandon that. We're watching the science. We're watching the risk. We're watching people's behaviors. Are we doing it? Are we doing it well in healthcare? I don't know that we're going to be wearing masks for the rest of our lives. I don't think so. I think we're going to be wearing masks a little longer. Watch the science, and remember, we're mostly trying to protect the most vulnerable.
Right.
It's really doing that. A lot of us are doing it for people, to be respectful for their health risks. And when you think of it that way, you don't want to take that mask off too soon.
Right. Yeah. And this is a conundrum that we experience a lot in public health. When we do all the things right, nothing happens.
Oh, yes.
Our result is invisible. Right. And so it really can feel like, oh, well, COVID, that would have been no big deal. See, look, we only ended up with, right now we've got less than 700 cases in our county. We're at under 60 deaths, which all of those matter a lot.
They do.
But the way we were talking in late March and early April, we were bracing for it to be much worse. We expected more. But I do believe it was decisive action. As become more virus, it didn't quite as expected, but that doesn't mean that it wasn't a big deal, and that we should just let our guard down. Continued vigilance until we do have those levels of herd immunity remains important. Yeah.
I would wear my mask for another year to save one life in a minute. I hope it's not necessary that long, but when you talk about lives lost, we did lose 60 dear souls in Berrien County from this disease, and I believe we'd have lost a lot more had you folks not been paying attention, had not been careful. More so.
I agree. Yeah. So before we wrap up, are there any questions that we can answer?
Yes, Board of Contract Security firm unit. Can you talk more about what that was for?
The health department has had a facility on standby almost 2.5 months now, in the event that there was a cluster of COVID cases in a situation or among people that didn't have a safe place to quarantine or isolate on their own. So this could have been within a homeless shelter. It could have been within some sort of congregate living facility, among an individual that has a transient living situation. There are a lot of people in our community that don't really have their own home but are staying with others, and that welcome might not have been extended if that person was infected. So we know that isolation and quarantine are really effective measures in breaking that chain of transmission, and being the proactive health department that we strive to be, we put measures in place so that we would have a safe place for individuals who fit certain criteria to be able to go, so that they would not continue to pose a risk to the general public. All right, well, we appreciate all of your time. We don't have any more questions right now. Any parting words you'd like to share?
I'd just like to thank you folks for joining us over the last few weeks. We really appreciate your commitment to do that. And we hope you stay healthy and have a really great summer.
Yeah, absolutely. Again, thank you. It really does take all 155,000 of us to have good health here in Berrien County. Thank you.